Courage is defined as a quality of the mind or spirit to face difficulty without fear. A courageous person moves past obstacles with bravery and vision, one step at a time, moving along an uncharted path, pushing forward to their ultimate destination. Courage is pervasive in everything we do. Dr. Vibhakar is devoting his life to helping kids courageously battle pediatric brain tumors.
When I started training in 2002, 2004, 50-60% of our brain tumor patients, I would have to tell the parents that we really didn't have good therapy, that their children were going to die. I can actually now give them hope. We can tell them that we have new treatments. I can tell them that we understand why those tumors behave the way they do.
The biggest problem with research right now is we don't truly identify the best kids to get each treatment, and each kid is different and we need to treat them that way. There are not even other experimental medications in the country that these kids can take, so we're trying to design those here.
There's been pretty much about a 25% net decrease in real dollars of NIH funding for research across the board. And then so cancer research is a portion of that, and then children's research is even a smaller portion of that. So the number of dollars that go into children's cancer research are really small.
We need to do a better job of explaining to the community what research means, the kind of research that comes up with a cure. It's not the kind of research that you put in a book and put it on a shelf. We are talking about things that make a difference to kids.
So that's where the research and the clinical research comes in, because now we have access to newer drugs that drug companies are developing, newer ways of treating tumors that may not exist in other places. You now have access to all these experimental therapies that can potentially provide you hope.
Through research and clinical care, Dr. Vibhakar and his team have secured futures for children that otherwise would not have been possible.
We have the potential of taking what we've done here and actually bringing it into clinic.
So I feel like research is really an important thing that we work on every day.
A lot of people say, oh, we don't fund research, like it's something that you wouldn't do. It's one of the most important things that we do at the university and at Children's.
Unfortunately, medical research is really expensive. Every dollar counts because it's the cumulative effect that really makes a big difference. So for example, I got $15,000 in a grant from the Morgan Adams Foundation, and we did a bunch of studies that led to the data that I was then able to take to the NIH, and so they just gave me $1 million to do the follow-on studies, but I would never have been able to propose that project unless I'd done the early experiments.
There's really been a revolution in biology, and that biology is an influx of really very smart young scientists. The promise of Rajiv's work is to give us more targeted therapies. So we'll not only improve the cure rate, but we'll actually reduce the damage we do to children. These are the people capable of transforming therapy.
And now, we ask for your help in securing a future for these children. Better treatments and cures are within reach. Courage is asking for help. And helping is a gift to humanity.